Hey guys, let's talk about clinical trials. So I love clinical trials because this allows a method to innovate as a surgeon and to really be able to offer patients some of the most cutting edge treatments and surgeries and surgical devices that are coming out and available. We do this in a clinical trial setting because as new treatments and devices come out, we don't know 100% the efficacy, the side effects that are associated with these, and we don't want to just release it out into the public. Hey guys, let's talk about clinical trials. So I love clinical trials because this allows a method to innovate as a surgeon and to really be able to offer patients some of the most cutting edge treatments and surgeries and surgical devices that are coming out and available. We do this in a clinical trial setting because as new treatments and devices come out, we don't know 100% the efficacy, the side effects that are associated with these, and we don't want to just release it out into the public and approve it for use without safely evaluating it. How do we safely evaluate it? We do it in a clinical trial where outcomes and side effects and patients are monitored and evaluated under much scrutiny, much more than what we would normally monitor patients after undergoing surgery or being given a normal treatment that is already available for the mass public. So why do we need to do clinical trials? Because there's always new treatments that are coming out. There's new surgical devices or different methods that are coming out and available. And we want to be able to monitor these and evaluate them in a safe environment with by IRB approval and under FDA approval. So as a colorectal surgeon, I love participating in clinical trials, like I said earlier, and some of the trials that we offer patients, I'm going to list in just a second. But one more clarification I wanted to make is that some of the studies that we participate in are considered industry studies, meaning we're partnering with a specific brand or industry partner in order to evaluate a new device that they've brought out onto the market. And then there are also what we call investigator-initiated studies. Investigator-initiated studies are much lower risk things, but things that maybe we don't completely know and understand in the surgical management of patients. As an example, what diet is safe after colorectal surgery? There's a lot of discussion about this right now. And so we're doing a study trying to figure out which diet is better. And by doing it in a clinical trial, we can safely understand and evaluate this and have data to then be able to statistically analyze and publish in order to determine which is better than the other. So quickly, what are some of the studies that we have available? My favorite one is our anal stem cell study because anal fistula is a major disabling disease, especially in our Crohn's population, and stem cells are not FDA approved in the US. And so offering this to patients allows us to bring something to the table that was not available in the past. And it's really exciting to partner with these studies in order to evaluate the efficacy of stem cells in our fistula patients. The other one is a diverticulitis study looking at surgery versus medicine for our diverticulitis patients. We have several quality of life studies where we're evaluating the quality of life of patients after several surgeries. We have a device study that protects the anastomosis after rectal cancer surgery. There's a lot.